Hi, I'm Dr. Chris Pagnani. I'm the medical director and founder of Rittenhouse Psychiatric Associates. I'm an instructor at the Johns Hopkins Hospital for the Department of Psychiatry, and I supervise psychiatric residents at Jefferson Hospital. I'm excited to discuss a service that we provide at Rittenhouse Psychiatric Associates, which is the deprescribing of psychiatric medications. Individuals might be surprised to hear me say that, but psychiatric medications can be incredibly valuable to individuals who struggle with mental illness. And so it's very important that people do not stop their psychiatric medications, that they're taking them, and if their symptoms are controlled, without consulting with their mental health professional. With that being said, it's not uncommon for someone to come into the office and say, you know what, doc, I've been taking this medication for a year, 2 years, 5 years, 10 years, 20 years, and I'm not really sure what it's doing for me anymore, or if I really need it anymore. And they may say, when I've tried to decrease this medication, whether it's an SSRI or SNRI or a benzodiazepine or even buprenorphine, they might say, when I've tried to decrease this medication, I've felt brain zaps or had insomnia or had a sudden increase in anxiety or felt dizzy or just felt really off. So I went right back up to my previous dose, and I've been on it now for the last decade. And so it can become very unclear whether a patient actually needs to stay on a medication that they've been on for a long, long time, in terms of whether they need to stay on it because they have withdrawal if they try to decrease it, or if it's actually helping them with their underlying mental health difficulty. Sometimes medications are started when someone's really struggling or having a lot of symptoms, and those situations might pass, and that person might work on diet and exercise and other behaviors. They might have worked on substance issues, and now they may actually not need that additional support from the psychiatric medication. And so the providers at Rittenhouse Psychiatric Associates, we're actually, I've been personally trained, and I'm able to train the providers that work here on the deprescribing of medications. And not only are we able to use the doses that are made available by the companies who make these medications, but we will actually work with compounding pharmacies to make doses in between the doses that are available by the producers of the psychiatric medications, to make tapers as smooth as possible and to make small decreases at a time if that's all that the patient will tolerate. So we can do this, work with compounding pharmacies for, again, your SSRIs like Prozac, Zoloft, Lexapro, Celexa, Paxil, your SNRIs like Effexor and Cymbalta, medications like Remeron or mirtazapine, Benzodiazepines like xanax and Valium and klonopin and Ativan, and even buprenorphine. And so we found that by offering this service, we were able to actually take patients off of medications that they may not actually need, or decrease them to lower doses and expose those individuals to decreased side effects. Because if over time someone, you may not actually be successful in terms of bringing a patient completely off the medication, but you may find that they need actually a significantly lower dose than what they've been on for the last 10 years. And that may actually decrease any side effects that they have, like sexual side effects or feeling cognitively dull or dampened or over-medicated. And that can be really beneficial for the patient. So any questions, call Rittenhouse Psychiatric Associates. Amy, our office manager, or one of our admins will be happy to pick up the phone and discuss.